Welcome back to CBS News Detroit at 4. Women who have surgery as part of their breast cancer treatment may choose breast reconstruction surgery to rebuild the shape and look of their breasts. However, the surgery itself is surrounded by misconceptions. Doctors Danielle Deluca-Pytell and Linsey Gold join us in studio to break down the most common myths to help women stay informed. Thank you both so much for being with us this afternoon.
It's our pleasure.
Can we start by talking about what breast reconstruction is?
Sure. So breast reconstruction is surgery that helps put the breast back together after surgery to remove some or all of it for breast cancer. And you can have partial reconstruction if part of the breast is removed, or you can have complete reconstruction if the entire breast is removed.
Okay, so two different types of surgeries there. Who is best suited for one over the other? What are the most distinguishable differences?
Most of the time, it's the cancer that determines the particular type of operation. About 85% of women are candidates for lumpectomy to keep their breast, but sometimes we still need to do partial reconstruction. If mastectomy is required or chosen, then we coordinate between the oncologic surgeon and the reconstructive surgeon the type that's most appropriate for the patient.
Something I've heard people wonder about or ask, there seems to be, I wouldn't say debate, but misconceptions. We'll call it a misconception. Does getting an implant hurt your risk of detecting cancer in the future? Is that something that you need to weigh as you consider them?
So no, having breast reconstruction, whether it's with an implant or part of your own body, does not increase your risk of breast cancer. And that's for somebody who's already had breast cancer or for somebody who's having an implant placed for cosmetic purposes.
If a woman has had radiation, does that mean she can't have breast reconstruction?
No, it doesn't. It's a part of this is, I think it's how you're taught and how much risk you can tolerate.
Okay.
So for when I was being taught, if somebody had radiation and needed to have reconstruction after mastectomy, then you needed to use your own body's tissue to do that reconstruction. That operation, as opposed to using implants, is a lot more difficult upfront. There's a lot more recovery time. There's a second surgery site, and because of those things, it's looked at as harder, less desirable. There's been a change of thought that perhaps people can have implants in a radiated field, but it is not without risk. There's always a higher risk of problems with the look and feel of the reconstructed breast, symmetry with the other breast if it's not been reconstructed, and there's also a risk of reconstructive failure where it just doesn't work out. So I think it depends on the patient and the physician whether or not that's something that's offered.
And these are all issues that are taken into consideration as we coordinate efforts. And if we know the patient's going to need radiation, then we coordinate our care so that all the risks are known to the patient.
Dr. Gold, I'll direct this question to you. How often do breast implants need to be replaced?
That's probably your question.
Oh,
but
see,
I like
you
to
had
tell,
a good analogy.
I know, because I like to tell ladies that they're not like tires. They don't have to be like rotated or changed out every 10 years. I don't know where 10 years came from, but it's what a lot of people think. If they're not broke, don't fix them.
So the 10 years it comes from the warranties that come with breast implants. So the breast implants are always warranted. So if you ever have a break of your implant, the manufacturer will replace it, whether you have it for cancer or cosmetic surgery. But at 10 years, the warranty changes. So it typically is more for cosmetic surgery, but everybody just thinks that like their implants are going to expire. The implants are made a whole lot better than they used to be made. So now they may be broken and people may not know. So you do actually have to look at them periodically. And that's an FDA recommendation that every 3 to 5 years, people with breast implants have them imaged to make sure they're not broken.
So we're talking about misconceptions, and I love that you were able to debunk that one, but also kind of explain why. Overall, though, very quickly, why do you think there are so many misconceptions with this field, with breast cancer, with implants? Is it because we don't talk about it openly enough, so things just kind of stay incorrectly out there?
The internet. Because breast cancer is so common, everybody knows somebody. people have been through it, and sometimes if you go through something, then you feel like you're an expert on the topic. Of course, you're only an expert on your particular situation, but that gets generalized. So I think it's just a lot of the publicity that happens. I mean, we're in Pinktober right now, so
Absolutely.
it's at the top of everybody's discussion list.
One big reason we have you on with us. Thank you so much. We appreciate the insight and bringing attention to this month. Doctors, thank you both.
You're welcome.